Kabayan Radio 94.3. We are online for you 24/7. The People's Radio Station, Kabayan Radio 94.3. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
A wonderful evening mga kabayan. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. This is another episode of Candid with Candy and sisimulan natin ang ating programa ngayong gabi with our segment na The Doctor is In. My name is Kenzo.
And of course, mga kabayan, this is RJ Andi and it's going to be a great talk na naman kasama ang ating very beautiful guest for tonight para sa ating Candid with Candy special episode of The Doctor is In. At hindi ko na papatagalin, partner, because I'm so excited to ask questions. Now, right now, we have a dermatologist with 16 years of experience and have been working in Qatar for 8 years, partner. Imaginein mo ha. We have GP Dermatologist of Family Medical Polyclinic, Dra. Ethel Cajefe.
Hi.
Magandang gabi po.
Yeah, nice to be back.
Yes.
We actually have Dr. Ethel back in March of this year.
Okay.
Parang earlier part of March. And pinag-usapan natin during that time yung mga ilang procedures on how we can have youthful appearance, di ba? So, Doc, since malapit na ang summer, or actually nasa ano na tayo, tag-init na talaga, no?
Mainit na siya, partner.
Pag-uusapan natin ngayong gabi, ano nga ba yung mga concerns na meron tayo, skin concerns na lumalabas during the summer season, and at the same time, ano yung mga treatments na available, and kung meron na kayong ginagawang treatments before, okay pa bang gawin yan during the summer period. So, ito ang pag-uusapan natin ngayong gabing ito.
At syempre, partner, ang daming mga kababayan natin, especially mga kababaihan, na very conscious when it comes to summer. Kasi doon daw talaga magkakaalaman kung ano yung ginagamit yung mga sunblock, pang skincare nyo, kung talagang effective ba. Now, first question para sa akin, partner. Kadalasan po ba, Dr. Ethel, ano nga ba yung mga common skin problems when it comes to summer na nakukuha nyo?
Okay. Well, summer actually, marami talagang skin problems that arise from this weather. Mostly because of the sweating. So, isa na doon, of course, excessive sweating, which is hyperhidrosis. Isa yun sa mga common problems. Another thing is still because of sweat, may tendency ma-block yung mga oil glands or yung mga pores natin. So, nagkakaroon tayo ng other form of condition na nagkakaroon ng folliculitis, mga boils, yan. These
ano
are
yung
common.
folliculitis, Doc?
Folliculitis, it's a form of infection from the hair follicle. So
Okay.
pagka napupul yung hair follicle tapos nabablock siya or nakaklag siya, specifically with sweat because of excessive sweating, so nagkakaroon yun ng parang bumps.
Okay.
And then if this gets infected, so nagiging deeper yung infection, it becomes boils. So yun naman yung furuncle. And then may carbuncle. So these are all, pareho lang yung pinanggalingan nila. And these are more common in summer. Lalo na kapag masikip yung lugar,
Right.
ay
Right.
crowded, ganon. So these are more common. Yes.
Crowded dahil po ito ay...
Well, like boils are more common sa Philippines sa mga prison.
I see, okay.
It's because of the
Of the
yung crowding.
environment.
Crowding siya nakakahawa kasi this is
Right.
bacterial infection
Right.
na eh. So here may boils pa rin because nakaklag pa rin naman yung pores because of the sweat. So these are common also. Another one which is also common in kids, yung prickly heat, yung most commonly known as prickly heat. It is known as miliaria. Ganon din yun because of the sweating din because nakaklag din yung pores.
Ito po yung tinatawag ba natin na bungang araw
yan,
sa
yung
Philippines?
bungang araw, ayan, yung bungang araw. So these are very common in summer. Tapos aside from that, merong mga minsan nag-a-arise yung mga allergic reaction during summer kapag may allergy ka sa sand or sa sun. Sometimes people are photosensitive or allergic to lights, ganun. So it's also common in summer. Meron din other types of allergies, and then minsan din common yung mga fungal infection. This is also because constantly moist yung area because of the weather, so nagiging breeding ground for fungal infection. So dun nagiging common yung mga sa toes. Yung mga infection, mga commonly known as mga alipunga, mga ganun. So summer din siya nag-a-arise, or more common in summer.
Alright.
Well, acne can also break out during summer, especially yung sa back. Most specifically sa back, dahil pa rin sa sweat yun. So those are, and a lot more, I think, na.
Are there any precautions that people can do during the summer? Gaano ba kadalas dapat maghilamos kung sakali
Or maligo?
Yeah. Diba?
Yeah, as often as you can. Kasi yun yung difficulty with summer din kasi the sweat, once hindi siya matanggal, yun nga, nakakaklag siya ng pores. So if you can keep yourself dry and clean, so kung galing ka sa labas, maligo ka talaga para matanggal yung dirt. Kasi dirt and the sweat are the primary cause of these conditions. Well, aside from this, palang nakalimutan ko sabihin, yung melasma, another common condition during summer. Tapos, yun, yung hyperhidrosis, I think I've mentioned that already. So,
meron po bang mga pwedeng gamitin or mga hindi dapat gamitin during the summer? Like for example, there are people who use moisturizer. Okay lang po bang gumamit nito? Kasi iba iniisip, di ba? Ang init na nga, mag-moisturizer ka pa, di ba? Pinapawisan ka na nga, maglalagay
So
ka pa
parang
lang.
mas iinit pa para sa kanila, mas mabigat
diba?
sa pakiramdam.
So are there like any products that people should be avoiding during this particular period?
oo. Well, yung moisturizer naman, it will help kapag dry talaga yung skin. So whether it's summer or winter, kung dry talaga yung skin, it will help if they will use moisturizer. Pero sa normal to oily skin, I would suggest that you avoid moisturizer because you don't need it during summer. What you need more, keep your skin dry, tsaka lots of sunblock
Okay.
or sunscreen.
Sunscreen.
Ano po ang recommended na sunscreen? Kasi
Yes.
may mga SPF,
SPF 30,
diba?
SPF 50.
Well, actually, yung SPF, it's just a measure kung ilang percent nung ultraviolet rays yung makakapenetrate sa skin mo.
Oh,
So,
okay.
if it's SPF 30, mga 97%
Mabablock.
mabablock niya. So, actually, yung 30%, it's 97%, it's enough for as long as you reapply every 2 hours.
Every 2 hours
Pero
po.
syempre, the higher the SPF, the better the blockage. Like,
Okay.
kapag 50 or 100, mga 99% na yung nabablock niya na ultraviolet. So, pero make sure that you use yung broad spectrum na sunblock kasi yung SPF, usually ang binablock lang yan is the UVB, which is the ultraviolet, yung B type. We still have the UVA,
Yes.
which will cause aging. So yung UVB, that's for sunburn. So hindi ka masa-sunburn because of the sunblock, pero the part of the UVA can cause aging pa rin. So look for yung broad spectrum na sunblock.
Broad spectrum, okay.
So yung broad spectrum po ba na yon ay kapareho nung, kasi may mga iba nakalabel UVB, UVA. Yun po yun.
Kapag ka broad spectrum.
So it could be nakalagay dun sa label niya, broad spectrum or UVA or UVB nakalagay doon.
Kasi kapag finalo mo lang yung SPF, it's only for UVB.
Okay.
So you have to check if it's broad spectrum or nakalagay nga UVA.
Pero may question ako, Doc, regarding dyan sa pagre-reapply, di ba? Nabanggit niyo po every 2 hours.
Yeah, every 2 hours.
Kailangan po ba, kung kunyari sa mukha, kailangan po bang i-wash ko muna yung mukha ko bago ako mag-reapply or I can actually reapply? Kasi di ba parang minsan,
Parang lagkit-lagkit ka.
oo, tapos
Mag-apply ako
naglalagay
ngayon.
ako. Oo, di ba?
Pero not necessarily kasi meron namang sunblock na na-absorb even kung
okay.
kahit may makeup ka pwede. May dalawang klase kasi ng sunblock. We have the chemical and the physical sunblock. Yung physical sunblock, these are more natural. Pero although it's natural, yun yung nagli-leave ng marka.
Okay. Yung parang maputi?
Oo, parang gano'n, namumuti.
okay.
So kung ayaw mo na ng tanggalin yung makeup mo, mag-chemical sunblock ka. Kasi this one more absorbent.
Okay, that's
This
good to
applies
know.
more on women, right?
Women,
Kung
yeah.
gusto nila.
Yeah.
But for men, I think they do have the choice if gusto
Yeah.
nila mag-wash up again and then reapply. And doc, related din sa reapply kasi a lot of advertisements were saying na kahit 24 hours of
Exposure.
exposure of the sun, kayang-kaya daw ng kanilang product, 'di ba? Tapos you recommended 2 hours. So does it really apply? Like for example, I have this best kind of sunblock. Mataas yung SPF niya. Do you think the 2 hours reapply should still be done, or it depends on the kind of product at kung ilang SPF siya?
Well, usually kasi yung sa SPF, yung pag-block niya ng UVB, actually, lang yun for a certain period of time lang talaga. So, it after 2 hours, you really have to reapply. Pero for other products, I don't know what studies they do, pero meron nga mga ganon na 24 hours.
No
good
need to
enough,
reapply.
No need to
ganyan.
reapply. Pero ako, I still suggest that you do reapply kahit na you extend it longer than 2 hours. Pero the important thing, especially if you're going out, you
Right.
still have to reapply.
Okay.
And gaano po katagal? I mean, before ka lumabas, ilang minutes ba dapat na i-apply mo na siya bago ka pa lumabas?
Around 15 to 30 minutes.
So ganun pa po katagal bago magte-take effect
yung effect.
yung product.
So I did it wrong.
So, kasi ina-apply mo kaagad. Labas ka
Ina-apply ko,
kaagad.
tapos labas, ganyan.
Tapos yung after 15 minutes, nandun ka na sa sa pupuntahan mo, no?
Yes. Ganun
So
pala.
dapat po mga 20 to 30
Yes.
minutes
15 to 30 minutes
before
going
kayo
out.
lumabas.
Oh,
Okay.
guys, you have to take note about it. Kailangan maghintay ka muna ng mga 15 to 20 minutes kasi dun yung effectivity ng product. Okay.
Yes. That's good to know.
Yeah.
Kasi ang daming ang parang
Ang dami kong hanash, hindi ko pala alam.
nagmamadali kasi.
Nagmamadali kasi all the time. Ganyan.
Pero para po sa mga babae, Doc, ito bang sunblock? Kasi di ba naglalagay ng makeup, Saan ba to ilalagay? Before the makeup or after the makeup?
Before the
Before the
makeup.
makeup.
Before.
You apply
Okay, so
before
sorry
the
naman.
makeup.
Talaga ikaw na
Like I
sumagot,
should
diba?
say, you don't need to ask doctor. Ask me.
Baka kasi,
Diba?
sige na nga. Okay, nasagot
Why
na.
would they apply after makeup?
Hindi ko alam. Hindi ko alam.
okay,
Naisip
that's
ko lang. Anyway, ano pa po yung ilang mga products na dapat natin na inaalam na kailangan nating gamitin during the summer period, apart of course from the sunblock na pag-usapan na natin?
You mean the products we should use kapag
Yes,
summer, no? Well, aside from sunblock, it depends kung anong condition ng skin
Right.
Like, if you're referring to kung meron ka ng existing medical condition, I mean like yung mga folliculitis, yung mga bungang araw, if you have that already, ang magandang gawin dyan, always to keep yourself dry nga. And then, may certain creams that you can apply para ma-relieve yung itching niya. So, don't use petroleum jelly pala. Kasi yung petroleum jelly, it is oil-based. So, yung problem na natin dun sa prickly heat is oil. So, if you add more oil to it, baka mas aggravate yung condition.
Okay.
So instead, use like cortisone, mga cortisone cream, you can use that. You can use powder, it's okay. Or yung calamine lotion or calamine cream. It will help with prickly heat. So, I think common naman yung calamine kahit sa atin.
Right, right.
With bungang araw. So, yun, tama naman siya. And then yun, always take a shower as often as you can, lalo na pag galing ka sa labas to remove the dirt. And then don't overly moisturize. You can moisturize siguro at night, pero don't overly moisturize kasi nakaka-clog talaga siya ng pores.
Okay.
And then you can still use mga exfoliating creams because there are certain exfoliating creams that you can use on summer na friendly on summer naman. So yun yung mga
Yung hindi nagbo-burn.
hindi nagbe-burn, yung very
Oo.
mild lang. Yung mga fruit acid, yan.
Okay.
That will help.
Doc, nabanggit niyo po yung yung paggamit ng powder and other products pa during the summer. Niisip ko lang, hindi po ba siya minsan nakaka-block ng pores that would
Nagka-clog? Right.
nagka-clog siya na parang mas lalo ka magkakaroon ng pimples kasi hindi makalabas yung oil.
Yeah, isa yun, no? Lalo na kapag ka-oily yung skin mo.
Okay.
Pero the powder you can use to relieve for the prickly heat.
I see,
Oo.
okay.
Just to relieve the itching, gano'n.
Okay,
Pero,
okay.
you don't overdo everything
Right,
in excessive
right.
kasi hindi pa rin siya advantageous.
Right,
Okay.
right. So, ito po isa sa mga kumbaga home remedy kapag ka meron na kayong mga nararamdaman,
yes.
may nakikita na kayo sa skin niyo ng mga concerns or problems. So, Doc, ano pa po yung ibang mga home remedies that people can, take note of kung halimbawang meron silang mga prickly heat, nagsimula na sila magkaroon ng boil, and when is the right time or when is the time that they should go and consult a doctor or visit a clinic?
Okay. So, kapag uncontrollable na, kapag hindi na dadala with home remedies, kasi minsan, may persistent talaga na condition na hindi nawawala unless the doctor prescribes certain medication. Like, if you need yung cortisone cream, you cannot buy that over the counter.
Yeah.
So, definitely you have to ask yung prescription from a doctor. If the boil is too much, you might need already antibiotics, which also requires a prescription. Saka depende what kind of antibiotic will be used. So, yung mga conditions na you cannot treat anymore by yourself, you have to come and see the doctor.
Especially if
Alright.
you cannot sleep anymore.
Oo.
Especially kapag nasa back, diba?
Mhm.
That's very hard.
Yung
At
pagka-painful
mahapdi na talaga,
Na
no?
talaga siya.
And marami din sa atin ngayon, ang pupunta na sa dagat, magsiswimming,
Yes.
gustong-gusto natin yan. Ito po ang tanong, ano ang dapat na ginagawa para maiwasan ng sunburn? Well, of course, maglagay din ng sunblock. Pero ano pa yung mga steps for them to avoid having sunburns? And ano po yung mga dapat na i-apply pagkatapos nilang magstay under the sun? Ano din po yung oras na pwede bang magstay sa araw? Okay lang ba kahit alas 12 ng tanghali?
4 hours exposure, pwede ba yung gano'n?
Yung, well, ano pang pwedeng gawin, no, during summer to avoid sun exposure? Well, you can always use yung mga, hat, yung malalapad yung brim. So, hindi ka, pero always wear sunblock even if you're wearing hat. And then, necessary din yung glasses, yung shades. Kasi it will help you para dun sa eyes. Kasi you also get,
Even the eyes, right?
yeah, problem with the eyes. Tsaka also, because of the heat, you will keep on squinting. So, nakaka-cause din yun ng wrinkles. So, much better kapag ka
ganyan ka lang.
naka-eyeglass ka.
Huwag kang mag-sleep.
Kaya dapat
Di bali lang,
nakasalamin.
di bali lang
Huwag kang
masilaw ka, no? At least wala kang wrinkles.
Oo.
Yes.
Yun.
Oo.
So, dapat nakasalamin ka parate.
Meron akong question.
Sure.
Diba, we're using sunblock. And then, it's kasi minsan pag-uusapan, naka-highlight lang yung mukha eh. So how about like the neck and the other parts na na-expose? Do we have particular lotion na pwedeng gamitin na does have a factor then of, sun protection?
Yeah, actually, you also have to use sunblock for the body.
Okay.
Kailangan din ng
So
sunblock.
the same
kasi-
with the face.
Yeah.
Hindi siya pwedeng magkaibang product dyan. Dapat
Oo.
same lang.
Same.
Kasi baka dito, puti, dito pula.
Oh, yun
Yan na
na.
nga.
Itim.
Kasi magkaibang product.
Yun na nga. Lalo na kung halimbawang may suot kang relo, no?
Yes, oo nga.
Nag-iba-iba na yung kulay. Magmumukha ka ng zebra niya. Pagka,
Alright.
Anyway, mamaya. Ay,
Kasi-
Doc, you wanted to add something?
Yeah. Any exposed area, kailangan naka-sunblock ka parate. Kasi
Okay.
yung sun, it's not just burning, it's not just aging. Nakakause din ng cancer yan eh.
Right.
Yes.
So, you
Right.
have to wear sunblock talaga.
Pero ano pong advice nyo, lalo na dun sa mga parents na mag-outing sila together with the kids, okay lang ba, gaano katagal yung sun exposure na pwede kapag sila ay nagsiswimming?
Well, depende, no, sa init. Pero I suggest wag sila masyadong magtatagal. Like every hour, shade. Lalo na sa
okay.
ganitong
Totoo.
panahon. Tago for a while and then labas ulit. Pero hindi yung tuloy-tuloy na 4 hours or 6 hours under the sun. I would suggest in between, you cover up, you go to some place na shaded to avoid extreme sun exposure. It will also prevent you from getting sunburn. Kasi
Right.
kahit naka-sunblock ka, kung direct talaga yung sun exposure, you will still get tan Mangingitim ka pa rin even if naka-sunblock.
Okay. And actually, it's also a good suggestion, Kasi kapag nandun ka sa shade, marire-assess mo ngayon.
Oh.
Okay pa ba yung balat ko?
Yes.
After a few minutes, malalaman mo yan kung nagsimula na bang humapde.
Yun nga,
And I think
hindi
you
mo
can feel it
malalaman.
naman. If it's too much na of the heat, makaka-feel. Pero again, sa bata, wala
Yeah,
silang
lalo na kung
problema sa
dire-diretso
ganyan.
silang nasa arawan
Yes,
di ba?
oo.
So anyway, we'll just go on a very short break and then a little later, we will be discussing ano nga ba yung mga treatments pa din na pwede nating gawin. Kasi nung nakaraan na episode natin, together with Dr. Ethel, we talked about fillers, Botox, laser treatments, among
Yes.
others. Pwede pa ba nating gawin ito
During
the
summer?
So, yan po ang ating pag-uusapan. Keep your frequencies locked in only here on Kabayan Radio 94.3.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
The current time is 7:01.
This time check is brought to you by Family Medical Polyclinic, Alwocare and Al Azizia branches.
Gulf Dental Center, Airport Road, now offers a comprehensive rate for filling the interior from the starting rate of 100 Qatari Riyals and filling the posterior for starting rate of 150 Qatari Riyals with normal extraction for starting rate of 150 Qatari Riyals, scaling and polishing for 250 Qatari Riyals, and root canal interior for 500 Qatari Riyals. Visit Gulf Dental Center, Airport Road or call 7795-6366. You're in good hands with Dr. Alisa Cabarubias. For any information, please call 4411-3556 or visit Family Medical Polyclinic, Care in Al Azizia branch.
For your advertising needs, please contact Kabayan Radio Sales and Marketing Team at 4499-4943 or email at info@kabayanfm.com. Kabayan Radio 94.3 FM, bringing your business to the Filipino and international communities.
You're listening to the first and only Filipino radio station in Qatar. 94.3 Kabayan Radio. Kabayan Radio 94.3. Loud and proud.
Mga kababayan.
Kabayan Radio 94.3.
94.3 94.3 on your frequencies. Number one in your heart. Kabayan Radio 94.3.
You're listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
You are still tuned in to Kabayan Radio 94.3 at syempre live na live tayo sa ating Facebook page. Kung gusto nyo kami mapanood, all you have to do is go and visit www.facebook.com/kabayan943. And earlier, partner, pinag-uusapan natin kung ano nga ba yung mga common skin concerns that arise during the time of summer. And ngayon naman, pag-uusapan natin yung mga treatments na usual ginagawa natin para mapanatili ang ating youthful appearance, yung Botox, fillers, mga laser treatments, at kung pwede pa bang gawin yan during the summer. So, Doc.
So yun na nga, Doc.
That's the question. Okay pa po bang gawin itong mga treatments na to?
Well, actually, pwede pa naman. Especially, na-mention natin yung sa squinting. Mas okay nga na mag-Botox ka ngayong summer. Kasi it will prevent you from squinting. So, hindi nalalalim yung lines mo. Which will require more units of Botox kapag mas malalim. So, kasi ang nangyayari, your muscles are relaxed, so you cannot squint anymore. So this will prevent formation of lines. So,
Okay.
so yan, mas maganda nga
So
yung
kahit
kung
nasisilaw ka
ganun.
po, walang mga linyang lalabas na
Oo,
gano'n.
Wala.
Diretso.
Sir, paki-zoom po. Ganyan. Oh, so it's recommended pala, especially during summer na
Oo.
magpa-Botox. But
Yeah.
do we have like a level of Botox? Like, do we have like basic, moderate, or depende din yan
Extreme.
or extreme, or depende din yan sa pangangailangan ng
Oo,
client?
depende sa line actually. So yung level ng Botox, it's the number of units kung gaano kadami yung kailangan i-inject sa'yo na amount ng Botox.
Okay.
So kung hindi masyadong malign,
Si
konti
Kenzo
lang.
po, mga ilang level?
Grabe, ako talaga yung example.
Pero oo nga, yung mga ganyan, no?
Oo.
So, hindi pala siya like in general lahat na, okay doc, gusto ko magpa-Botox.
Isang
Isang
oo.
same lang lahat.
Hindi.
So, it depends
Depende
din.
sa
It depends,
severity
yeah.
Severity, yes.
ng concern.
Oo.
Pero Doc, mayroon akong nabasa dati. Sabi nila, yung mga nagpapa-Botox daw or nagpapa-filler, mas madalas silang kumuha ng ganong treatment kung mahilig silang mag-sauna or di kaya alam mo yung mga tawag dito? Steam bath, mga ganyan. Kasi kumbaga, parang, I don't know if the term is correct, parang nalulusaw daw or mas na-absorb ng katawan. So,
Is it right?
is it also the same thing during the summer?
Well, yung filler, may ganong effect, but the Botox hindi.
Okay.
Yung filler kasi it's hyaluronic acid. So it melts or na-dissolve siya through heat. So kapag overly exposed ka sa heat, ang mangyayari lang naman sa filler, it lessens the effectivity. So kunyari, effective siya for 1 year. Kung sobrang exposure mo sa heat, minsan magiging effective lang siya from 6 months to 9 months.
Okay.
Then you have to do it again. Pero yung Botox, wala naman siyang problema with heat exposure.
Okay. That's good to know. At least sure na ano.
And dahil napag-usapan din natin yung parang yung span. Yung Botox ba may span din? Like how
Yeah.
many years?
May span yung Botox. Like, kapag ka first time mo magpa-Botox, usually ang effect lang yan, mga 3 months to 4 months. And then as you continue doing it, kapag every time you do Botox, minsan naglalast siya ng 6 months, minsan 8 months.
Okay.
We call it retouch or reapply?
Reapply. You have to re-inject.
Reapply.
Yeah.
Okay.
Maintenance na yan.
Maintenance na siya.
Oo,
Pagka may
maintenance na
wrinkles.
Because I thought, like for example, I mean, siguro most of our viewers also thought na kapag pwedeng once mo lang gawin, it's not the case pala. You should reapply din.
You should redo it. Otherwise, babalik lang yung line mo kasi this is not permanent treatment.
Doc, how about yung microdermabrasion and laser treatments? Is it something that we can still do over the summer? Kasi ito medyo magiging sensitive yung balat natin,
Mag-open
ano?
yung pores.
Yeah. Well, actually, I would suggest that you limit your treatments ng mga laser treatments. Pero with laser hair removal, as long as hindi ka naman na-expose sa araw, pwede mo pa rin naman siyang gawin. Ang pinaka-dangerous part lang is yung mga fractional laser.
Okay.
These are the, medyo matapang na siya na laser treatment for resurfacing. So, mga CO2 laser because bawal talaga siya sa any form of heat. So, with this kind of weather, if you cannot avoid the heat for the next 7 days, then I would suggest you don't do it muna for a while.
Okay. So at
Pero
least for 7 days,
for 7
dapat hindi
days,
talagang
oo.
ma-expose sa araw.
hindi ka rin pwede mag-chemical peel because for the same reason,
Right.
masusunog ka.
Right.
Pero there are certain chemical peels actually that you can use during summer, which is safe during summer. Yung mga, mostly kasi na sensitive to sun, yung mga toxic na chemical peels, these are the TCA, yung mga ganun. Pero merong mga fruit-based or other chemical peels that you can use during summer.
Okay.
Pwede pa rin.
So ito pong chemical peels na to, ito yung ginagamit sa mga clinics mismo.
Oo,
na
sa
mga
clinics,
chemical pills.
oo, sa
Kasi
clinics.
meron ding mga available over the counter or nabibili natin sa mga drugstore,
Oo
di ba?
nga,
Or
no?
kahit sa supermarket, minsan may mga nabibili tayo ng mga AHA, BHA. These also have peeling di ba, effect. So okay lang po bang gamitin 'yon?
Well, these are home treatments. Tapos, yung mga AHA naman, these are milder form of peeling.
Okay.
So, you can use, pero I would suggest with assistance of your doctor. Kasi if you do it alone, pwedeng ma-overdo mo, pwede ka pa rin masunog eh.
Like with the right amount
With the
dapat.
right amount.
Okay.
And definitely, kapag ka naggaganito ka, apply ka ng any peeling creams, you have to be very conscious about the sun exposure, tsaka lagi ka talaga dapat naka-sunblock.
Ano po usually, Doc, yung nangyayari? And ano yung mga early symptoms na pwede mong tignan or i-observe bago mo masabi, wait lang, parang kailangan ko nang magpatingin sa doktor kasi mukhang naapektuhan yata ng araw yung balat ko after ko ng treatment.
Well, I hope hindi siya dumating sa point na may pigmentation na, kasi by that time it will be more difficult to remove the pigmentation. Siguro yung kapag ka nafe-feel lang nila na nag-overheat na, yung mainit na than usual yung pakiramdam nila,
Okay.
then you have to stop the using your cream and then you go to a doctor para ma-reassess and then mabigyan ka ng other creams that will help you.
Okay. Doc, the pigmentation that we're referring to, is this the same as the melasma or different pa?
Yeah, sometimes yung melasma, it's parang medyo it's pigmentation pero long time na and then
Alright.
it's bigger.
Kaya naging
So,
na siya.
Okay.
medyo mahirap na siyang matanggal. Pero you have mga hyperpigmentation na maliliit pa lang, like freckles, like
Okay.
that, which is easier to remove pa kapag bago pa lang.
Partner, meron akong tanong since
sure.
napag-usapan naman niyo yung parang pwedeng gamitin, these are the AHA, right? The products, and of course with the supervision of your doctor. Pag in-apply ba ito, does it have, may products ba na may heating effect? Kasi baka naman hindi ako kailangan tumawag sa doctor ko, baka kasi mismo na yung product is may heating effect. Meron ba? Meron bang mga gantong products?
Well, any products that has peeling, any peeling products actually, you will really feel heat after you
Parang
use
may
it.
burning
May burning
sensation
sensation talaga.
But not stinging na talagang
Oo.
too much na. If
Kailangan
it's too
hindi
much,
siya nagtatagal.
Yeah. I think it's just going to have that
okay.
sensation for a short
For
while
a
and then
short
later
time.
on mawawala.
Kasi baka maging confused sila na pag-apply nila is if especially for non-users like me. Pag in-apply namin,
Ay, ang hapdi.
tatawagan ko yung ano ko ganyan. Pero baka kasi yun lang yung effect niya.
Yeah,
right?
and sometimes, yun nga, kung first time your skin is sensitive pa, mararamdaman mo talaga yung heat. So what you have to do, if you feel that heat, siguro, give it mga 5 to 10 minutes, then wash it off.
Okay.
Pero leave it on muna for the next 10 minutes before washing off your skin. Para
Alright.
ma-reduce yung heat niya.
Alright.
But you can wash it off.
That's really good to know. Is there anything else, partner, that you would like to ask?
Wala, meron lang
Doctor.
nagtanong kasi, this is about the sunblock, okay? Coming from Leo Girl, sabi niya, pwede rin mag-sunblock kahit nagluluto dahil 3 hours nakaharap, of course,
Well, actually,
sa kalan.
oo,
ganyan.
any form of heat exposure, necessary yung sunblock.
Ganun ba talaga yun? Kasi may kaibigan ako, gabing-gabi, naglalagay ng sunblock. Sabi ko, ba't nagsa-sunblock ka? Gabing-gabi, kailangan daw niya.
Oo, lalo na kapag lagi ka nakaharap sa computer.
Even the
Right.
humid, right?
Yeah.
Kahit sa gabi, pwede kang mag-sunblock dito.
Yeah.
Kasi especially kapag super yung humid, then you have to really...
Tsaka yung
Actually, yung
ganyang
screen
light.
nga daw. Itong ganitong light po.
Extreme light, you have to wear sunblock.
Ang
Patay
tanong,
nga, Cody. Wala ka.
nakapag-sunblock ka ba ngayon?
Wala nga, Cody, pa kapatay nga yung ilaw.
Okay,
Baka
so yun
magkaroon tayo
pala.
ng pigmentation,
Okay.
alam na.
So we
Buti na
don't
lang
have
nandito
ano-
si Doc.
Of course, totoo. Buti na lang ni-remind mo. Pakipatay na, we don't need it. Wow. Anyway, Doc, pero nagtanong dito. Tanong niya, paano po ma-remove yung parang mga dead skin cells?
Dead skin cells sa face. ba?
Yes.
Yung dead skin. Well,
Cause din
actually,
ba yan ng araw, di ba?
pero actually yung skin kasi, may normal turnover siya. So, meaning, nagre-renew yung skin natin around mga 28 days. So, what happens is, kapag hindi siya nag-renew, na-accumulate siya and becomes dead skin. So with that, peeling pa rin. Pero the safest form of removal, diamond peel.
Okay.
If you're familiar with diamond peel, it's part of the facial treatment.
Right,
Minsan
right.
kasama na siya. So it's a mechanical treatment, mechanical machine that we usually remove the dead skin. So nakakatulong yun. The peeling creams will also help with removal of the dead skin. Tapos you can also scrub your face.
Yeah, actually, yun nga
mga-
sasabihin ko, scrubbing or paghihilo. Actually, hindi lang sa face, but the entire body, di ba?
Twice a
Is it
week.
okay? Is it,
Yeah, twice a week.
Kasi may nakikita akong, alam mo yung mga, syempre, with all of the vloggers around the world, nagre-react sila sa mga gumagamit ng, nagsa-skincare, like routine, like Hollywood stars. And then may mga nagre-react doon, you don't have to rub your face, you're hurting your face. I mean, is it true or are they overreacting? Well,
Some of them may be overreacting. Kasi pwede
yes.
ka namang mag-rub ng face, basta hindi mo everyday ginagawa.
Right.
Kasi you need to exfoliate your skin.
Gano'n po ba
You have
kadalas,
to
Doc,
remove
ang acceptable or recommended for scrubbing our face?
At least kahit mga twice in a week. Twice a week.
kasi kung
Pwede ka
everyday
mag-scrub.
naman, parang ninipis din yung balat
Oo,
mo.
Yes.
yes. If your skin is sensitive, kahit na once a month lang. Kasi nga, you follow the turnover of the skin, which is 28 days. So, follow mo lang siya para hindi mag-accumulate yung dead skin.
Alright.
Okay.
Do we have other questions, partner? From
So far,
our,
wala naman dito. It's more of, reaction lang din sa mga sinasabi
Okay.
natin dito. Yes.
Doc, is there anything else that you would like to add in this conversation? Mga precautions, mga bagay na dapat inaalam ng ating mga viewers and listeners on how they can take care of their skin?
Yeah. Well, just because it's summer, it doesn't mean that you have to stop doing something for your skin or exfoliating it or doing derma treatments kasi there are other available treatments that are summer friendly naman. Like, as I said, there are chemical peels that are friendly. You can still do laser treatments as long as you have precaution for the sun. Tapos, there are other alternative treatments like, I have not mentioned na yung PRP. We mentioned it before.
Okay.
This one doesn't necessarily have to be you don't have to be careful with sun exposure kasi it's direct injection and it's very very helpful with skin rejuvenation.
Para
So,
saan nga po
nakakatulong
pala
siya.
ulit, Doc, yung PRP?
It will maintain the youthfulness of your skin
Okay.
for pigmentation, for scars. So, kasi nagpo-produce ka ng collagen
Right.
which usually is done by the laser treatments, yung mga fractional laser. Since if you cannot do that, at least do something to stimulate yung growth ng collagen, which you can do with mesotherapy or PRP.
Okay.
So, marami pa ring alternative treatments na pwede mong gawin during summer. And don't lose hope kasi even on summer, you can still treat melasma.
Alright.
Only very careful lang tayo with sun exposure.
Alright. And of course, through the guidance and observation na din ng ating mga doctors like Doktora Ethel.
Yes.
Partner, feeling ko meron ka pang tanong, hindi mo lang tinatanong eh.
Hindi, kasi curious lang din ako when it comes...
Yung may kinalaman sa alcohol,
What? Yes! Alright, I'll have to ask this. I'm pretty sure I know the answer. But this is for awareness. Do kasi, usually, hindi, kapag super yung parang nagmamadali, like, kami dito nagla-live interview and then after this we have our Candid with Candy show. So sometimes I have with my full makeup on, diba? With live interviews because of course dapat hindi ka pale tignan. So sometimes kasi, Doc, hindi ako nagdadala ng yung cleansing.
Ang dami mong intro
Hindi ako nagdadala ng cleansing, okay? But I did use alcohol to wipe it out.
Which one? Yung makeup?
Yung makeup.
Pati lipstick na.
Well, actually, yung alcohol, you can use it for degreasing. Nakakatanggal siya ng oiliness ng skin. So, even during procedures for the clinic, sometimes you use alcohol to degrease yung...
Pero ito po yung disinfecting alcohol, ginanon niya eh.
Huwag mo nang sabihin. Eto po, Doc. Yan. Makita mo
Eksakto yan.
Pero
Wala na akong
mag-ingat.
choice eh. Bakit?
Dapat hindi everyday naman. Kasi
Hindi naman.
nakaka-dry talaga ng skin yan.
Oh, yes.
Pero you can use once in
I
a while.
don't have any choice na kasi parang super naman.
Pero
Very
sabi mo-
inappropriate for me to
Sabi
go
mo
out
kasi
like
nun,
this.
ang hapde eh.
Oo, gumanon talaga ako, Doc. Ang hapde talaga.
naka-on air po kami, hindi siya makasalita. Anyway, going dun sa susunod, yung sa totoo mong question.
Hindi ko tanong yun.
Ayun na nga, yung sa totoo mo ng question.
Okay, this is about melasma kasi especially for mothers like mga 40, 50 years old, ito talaga yung napapansin kong yung nagiging problema. Now, since you've mentioned na kanina, pwede pa naman din talagang mahanapan ng paraan na ma-cure yung melasma. I mean, do we have a certain sessions to follow? How many sessions do we have to do para mawala yun? Ma-minimize yung melasma?
Yeah, minimize is the word. Kasi yung melasma cannot be removed 100% na. Once there's melasma, the most we can do is to minimize the appearance. So, depende sa sa lalim ng pigmentation ng melasma, yung session na gagawin mo. Pero usually with the treatments like yung laser treatments or chemical peel, it's always minimum of 4 sessions.
4 sessions, okay.
Alright.
Alright. Well, it's good to know, especially sa ating mga moms out there na medyo nawawala yung confidence nila.
Yes,
No?
yes.
So, don't be afraid. You just look for the right doctor for you. And
Right.
we have that here at Family Polyclinic.
Yes. Is there any last mga tips na pwede niyo pong ibigay sa ating mga nakikinig at nanonood ngayon?
For this summer, you just keep yourself always dry. So, and always clean and take a shower regularly. Tapos at the same time, if you feel any signs of skin irritations that are persistent, definitely you really have to consult a doctor. Don't rely on self-remedy or self-treatment. And you can always visit a family medical polyclinic. And as I said, summer should not stop you from taking good care of your skin. So you can still come and visit us for all your skin needs.
Saan po nila kayo, Doc, pwede bisitahin? Saang location po?
Sa Alwokir, Family Medical Polyclinic and Alwokir branch.
And of course, pwede nyong hanapin si Dr. Ethel Cajefe. And anong oras po ang bukas ang inyong clinic?
Yung clinic namin is open from 9 to 9. 9 a.m. to 9 p.m. Except on a Thursday, we're only open from 9 to 5.
Okay.
Alright.
And then Fridays close po, ano?
Fridays
So
close.
Saturday to Wednesday, 9 a.m. to 9 p.m. and then Thursdays 9 a.m. to 5 p.m.
5 p.m.
And of course, we are also going to include na din yung links kung saan nga ba nyo pwedeng mahanap ang Family Medical Polyclinic, pati na rin contact numbers nila. No?
Yeah.
So thank you so much, Doc.
Thank you ulit.
Meron po kayong mga gustong batiin?
Yes,
Ang hirap.
shout out ka naman dyan, Doc. Ang daming nakikinig sa inyo dito, yung mga kakilala nyo.
Yeah. Hello. Hello sa family ko. Well, may dalawa akong pamangkin dito.
Okay.
Jan and Renzo and everyone in Family Medical Polyclinic, all my nurses, tsaka Mr. Muhammad and Dr. Mahmoud. Also, some of my friends, medyo marami sila, but I would like to mention Christina because I know she's watching.
Hi, Miss Christina.
Hello po.
Thanks for watching. Alright, and by the way, speaking of shout-out, i-shoutout lang din natin yung mga viewers natin. We've got Leo Girl, we have Rovelyn de Guzman, Steph Diaz Catalbas, at may nag-hi sa'yo dito, Doc, si Janela Santiago, and Isu. Ito yung pangalan niya dito sa Facebook. And happy 10-year anniversary pala to Sounds of Era Band na nakikinig sa atin ngayon. Shout out to Vanessa Casador and Amor Constantino.
Yes,
Hi,
happy
Amor.
anniversary sa inyo.
10th anniversary.
Actually,
imagine,
i-invite
huh?
nila tayo tomorrow eh.
Oh yes, why not, right? Ayun.
Anyway, maraming salamat po ulit, Dr.
Thank you.
Ethel Cajefe of the Family Medical Polyclinic. And again, you can always visit them and set an appointment para ma-check kayo ni Dr.
That's right.
It's
mga
always
kabayan.
nice to be here. Thank you.
Thank you din po, Doc.
And again, sa lahat mga nakikinig at mga nanonood sa atin ngayong gabing ito, we do encourage you to really take care of your health and as well as your skin, lalong-lalo na during the summer season. Once again, maraming salamat to Family Medical Polyclinic for sponsoring this segment. The doctor is in dito po sa Candid with Candy. Once again, my name is Kenzo.
And my name is Andi mga kabayan, but don't you worry, up until 9 p.m. po ang Candid with Candy, so don't you go away. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
The current time is 7:24.
This time check is brought to you by